So I'm going to talk about 3 things that I see in PLAB 2 that often cause people to struggle to pass this really important exam. I'm Dr. Amin Arora from Aurora Medical Education. We're currently in Goa. We're vacationing right now. If you guys are in Goa, please do put a comment below. It'd be great to catch up for a coffee. I'm just going to get a bit of water because it is super humid here. But I want to talk about 3 really important things that I see a lot in candidates who prepare for PLAB 2 that get them into a bit of trouble, i.e. not allow them to demonstrate the kind of things that they're able to do and therefore struggle to score marks in a PLAB 2 case. Number 1, being too structured. Number 2, being too clinically orientated. And number 3, trying to achieve too much in the allotted time. Let's go through them one by one and hopefully we can help you in your PLAB 2 preparation. I'm Dr. Amin Arora from Aurora Medical Education and I really hope this video is going to be of some value. Let's go. So let's start with number 1, being too structured. And if you've done any preparation for PLAB 2 so far, you'll have heard about this don't be too structured type of rule that people talk about all the time, or people often say, I need to have a structure. And when people talk about structure, and when we do practice for PLAB 2 in our live courses and online courses and things like that, we talk a lot about structure not being what order do I do things, i.e. I need to do this and then this and then this and then this, for example, present a complaint, history, present a complaint, family history, social history. That is too structured. And sometimes people try and be structured because they think that's what they're supposed to do. So they go into any role play, any scenarios, no matter what it's all about, they will try and do things in a certain order, okay? So they try and be too structured because they think that that's what is important, that's what's being looked at, that's what's necessary. Now, when you try and be too structured, a couple of things are going to happen. Number 1, you're going to put a lot of pressure on yourself because your gut feeling will be telling you to do something, or a question will come to your mind, or an avenue of exploration will come to your mind, but your brain will say, no, I've got to stick to the structure because that's what's important, and it will cause a lot of confusion and stress in your mind because your gut feeling is telling you to go one way, but someone has told you, or some rule we think is in place that tells you to go this way, and that causes a lot of internal stress. Number 2, it means that you're going to miss cues because you're going to be talking about certain questions and a cue is going to pop up, either a verbal or non-verbal cue. The patient says something or something like that. And you want to go there because it seems reasonable, it seems like the right thing to do. But because we've been told we should be structured, or because there are marks for being structured, we try and follow this pattern. So one thing that I often see people who struggle with PLAB 2, and I do role plays a lot with doctors who are preparing, is this need to be structured because that's the mark. Now when we talk about structure, we talk about how structured are you in your mind, not how structured are you in terms of a 1, 2, 3, A, B, C approach. Okay, so for example, when you're doing something in data gathering like red flags, are you structured? Do you seem to go through it in a logical way? Or are you halfway through red flags and then something else pops up and you ask that, and then something else pops up and you ask that, and something else pops up and you ask that? That's a cluttered, unstructured role play. Now, just because someone doesn't go A, B, C every single time, and they might do things in different orders, like red flags first in one case, but then psychosocial first in a different case, as long as you're structured in the way that you're going about your data gathering, i.e. not jumping all over the place and not looking all haphazard, and having some kind of organization in your mind, demonstrating that organization when you're having that conversation with a role player, then you're going to do perfectly fine in terms of structure. But one of the common areas that I see people struggle with is they try and be too structured, but that for them means trying to do things in a certain order. So if you're preparing for PLAB 2 right now, make sure you don't get into the trap of trying to be too structured, i.e. having a structure that you follow again and again and again and again, regardless of what's in front of you, regardless of the presentation, regardless of the kind of ambience or the emotions going on in a consultation. Have the flexibility to go where you deviate from that path, but make sure you're showing structure in your mind by the way that you're doing things in an organized and categorized way that A, shows that structure, but B, allows you to save a lot of time in your consultations as well. So that's the first thing that I see commonly in people who struggle to pass PLAB 2. Number 2, the second thing that I often see people struggle with is they try and be too clinical, or maybe they don't try and be too clinical, but they just are too clinical. So for example, someone comes in with, I don't know, let's say back pain, for example. Now, of course, when someone comes in with back pain, we have to do certain clinical things. You have to go through red flags, you've got to go through the story, you've got to go through what happened, what makes it better, what makes it worse. You've got to rule out significant pathology, of course, and when it comes to management, you've got to manage the back pain, okay? So you've got to manage the cause. If it's simple back pain, you'll talk about, things they can do, things that you can do, medical options, guidelines. Of course, you've got to cover these things within your PLAB 2 role play. But one of the problems that I see when people do role plays with me and come to our courses is that they are very much too much clinical, okay? So there's so much else that needs to be fitted into your consultation, both from a data gathering point of view, but also from a management point of view. And if you're not focusing on these areas, it doesn't matter how much you know in terms of how to do a decent history for back pain and how to manage back pain and explain what to do in terms of treatments. It doesn't matter how well you do that, you're going to be leaving marks on the table because there's so much more that can be achieved. So one of the common mistakes I see is that people go very, very clinical focused. And of course, there are some cases where clinical is the predominant thing, there's no doubt about it, but there are always other things to do. Now, one of the things that we always talk about, for those of you who've done our courses and seen our online courses and done our mocks, for example, will know that we talk about 3 bubbles: red flags, psychosocial, ice. Now, clinical is only one of these 3, so it just shows you there's so much more that we need to be understanding in the first half in terms of the patient's mind, ice, and in terms of the patient's life, i.e. psychosocial. And A, you've got to understand all that in the first half whilst doing the clinical. But B, you've got to manage those things in the second half, because if you want to get a good score in the second half, you can't just be managing clinical. Now, being clinicians, that's what your brain wants to do. What's the diagnosis? What's the treatment? We're very used to doing that. But in an exam like PLAB 2, you need to make sure that you're not being too clinical, that you're thinking about the other aspects, okay? PLAB 1 might be testing you about your core knowledge of medicine. PLAB 2 is now about, okay, how do I first assess a situation clinically and beyond, and then how do I manage that situation clinically and beyond? And one of the commonest things that I talk about and teach on things like the audios and mocks that we do is how to strike that balance between clinical and non-clinical, and when to know which type of case to go further in one and less in the other. But one of the common areas of struggle that I see in people who don't pass PLAB 2 is this very, very heavy overemphasis on the clinical side of things, where there's just so much more that you can achieve in the allotted time. Now, the third thing that I talk about a lot in terms of where people might struggle with PLAB 2 is that people often try and achieve way too much in the consultation time. Now, the PLAB 2 consultation, you guys know, is not very long, but there is plenty of time in there to demonstrate certain skills, both in the first half, interpersonally, and in management as well. But one thing that I often see is that people just try and achieve too much because they think, or they've been told, or they presume that you must finish a consultation within the allotted time. Now, okay, there's so much stuff that sometimes goes on within a role play scenario, so many issues that are there, it's impossible to try and finish it in the allotted time. And if your brain is saying that I must finish it by the end, that is going to cause you to cut corners. That is going to cause you to rush. That is going to cause you to not even allow the patient to speak because you've got so much to say. That is going to cause you to be a very doctor-centered type of consultant when it comes to the exam. So the one thing that I want to talk about, and we talk about a lot again when we do our teaching and role plays, is that please don't feel like you need to have completed everything, said thank you very much before that bell goes, okay? As long as you demonstrate a couple of things before that bell goes, you're usually fine. Number one, have I understood all of the issues that I need to understand as a clinician? I.e., have I done a decent data gathering? Have I understood both clinical, mind, and psychosocial issues? Have I packaged them all together and come up with an overall assessment that I'm supposed to do as a clinician? Number one. And number two, have I demonstrated in the second half, before that bell goes, that my management plan is based on all of these issues? I.e., we talk a lot about the first minute of management and making sure that your issues are on the table. Can I demonstrate before that bell goes that I'm taking the story forward, I've got a couple of key things that I'm going to focus on, and I've probably dealt with one or two of those in detail before the bell goes? Not, can I understand all the issues in the first half, and then can I manage all the issues in the second half? If you're trying to achieve that, you're trying to achieve too much, you're going to talk too fast, you're going to leave the patient behind, it's going to appear very doctor-centered, and you're not going to get those IPS marks or the management marks because you're just trying to achieve too much. So if you're doing PLAB 2 practice, and we talk about this all the time in our audios and mocks and online courses, it's all about just having a simple idea in your mind. Number one, can I understand all the core issues in the first half and demonstrate that I'm doing that through the questions that I ask? And number two, can I demonstrate that my management is of the whole situation, not that I can manage the whole situation within the key minutes of time. Okay, so it's about getting that first minute of management right. It's about being time efficient. It's about understanding how to control a 2 to 3 minute management plan, not thinking how can I squeeze everything into a 2 or 3 minute management. And one thing I really see so often in people who struggle with PLAB 2 is that they understand so much in the first half and then just try and fit it all into the second half, and that is a recipe for disaster. That is a recipe for you talking way too fast and achieving very little in the small amount of time that you have. And we talk about this on our videos. If you have a look at YouTube, there's lots of management plan videos that we talk about, issues on the table. We talk about it on our courses as well. Please don't try and complete every single case before that bell goes. So 3 really important things there that I think I see really commonly people struggle with PLAB 2. Number 1, people appear too structured. Number 2, people are too clinically focused. And number 3, people trying to achieve too much in the time that's allotted. Now we cover these 3 things and many more on any of our PLAB 2 resources, whether it's PLAB 2 live course, whether it's PLAB 2 online course, PLAB 2 audiobooks, flashcards, mock exams. So if you want any of those, please look at the website and use the coupon Aurora Video 10, okay? Aurora Video 10, ARORAVIDEO10 for 10% off anything on the website when it comes to PLAB 2. If you like this video on YouTube, please do like, comment, share, and subscribe to the channel, because we have so many more PLAB 2 style videos when it comes to comm skills, IPS, data gathering, management plan, how to manage your 8 minutes, all that kind of stuff that people often talk about is covered on the channel. So please do have a look at that and see if it can offer you some value for your preparation. I really hope this video has been of some value. I hope to see you at some point in the future for some PLAB 2 practice. Hashtag Campus will pass. Hashtag I went with Aurora. Goodbye from sunny and humid and beautiful Goa. Take care.